Welcome to my channel Only Ankylosing Spondylitis. Today we discuss top 10 symptoms of ankylosing spondylitis disease. Ankylosing spondylitis. Ankylosing spondylitis is the type of arthritis which means it causes inflammation that affects joints. It typically affects the joint of the spine leading to back pain and stiffness, but it can affect other joints too, such as the knee and the shoulders. Ankylosing spondylitis symptoms vary widely. Pain is always a symptom, but the location and quality of pain can be different from person to person. Pain is typically accompanied by other symptoms such as fatigue or eye irritation. Top 10 symptoms of ankylosing spondylitis. Number 1. Pain and stiffness. Many people report pain with stiffness that appears over many months. Pain most often occurs in the Number 1 low back, number 2 alternative buttocks, number 3 hip, number 4 thigh. This is the radiating pain that typically does not go past the knee. This pain results from inflammation of the lower spine and or sacroiliac joints. The sacroiliac joints, sometimes called the isosacroiliac joints. Or where the sacral bone, a triangle-shaped bone located at the bottom of the spine, attaches to the ilium bone of the pelvis. Inflammation of the sacroiliac joint is called sacroiliitis. People with sacroiliitis may notice pain when sitting down or standing up, when climbing stairs, or after a run or strenuous walk. People with ankylosing spondylitis may also report these pain-related symptoms. Number 2. Neck pain. The neck may be painful and or stiff. Turning the head may be difficult, making certain activities such as driving more challenging. While anyone with ankylosing spondylitis can experience neck pain, women tend to report it more frequently than men. Number 3. Peripheral joint pain. About half of patients with ankylosing spondylitis develop inflammation of joints in the arms and legs. Peripheral pain and stiffness is most common experienced in the Number 1 knee, number 2 shoulder, number 3 ankle, number 4 Achilles tendon, number 5 plantar fascia, causing pain at the bottom of the heel. Children with ankylosing spondylitis often report pain in their heels and or knees, not the low back. Number 4. Improves with exercises. Pain and stiffness that improves with exercise, unlike back pain from other causes. Pain from ankylosing is worse during periods of rest or inactivity. Exercise typically helps reduce pain. Number 5. Morning stiffness. Morning stiffness. Affected joints may feel stiff after getting out of bed and may improve with movement or a warm shower. Number 6. Pain and sleep problem. Pain that interrupts sleep. Many people report that pain wakes them up, often in the second half of the night. Number 7. Tenderness. Tenderness. Many people report tenderness over the area of inflammation. For example, pressing the skin over the base of the spine may be uncomfortable or painful. Number 8. Painful flares. Painful flares. Almost everyone with ankylosing spondylitis reports experiencing painful flares, periods of time when symptoms are noticeably worse. Flares can occur suddenly and cause pain and stiffness all over the body. Flares may last days or weeks and are followed by periods of relative relief. Number 9. Eye redness. Eye redness and pain. Between 30% and 40% of people with ankylosing spondylitis experience an inflammatory eye condition called uveitis at the least once. One thought it is often recurrent. Uveitis, sometimes called iritis, can cause eye redness, eye discomfort, sensitivity to light, and impaired vision. This condition warrants immediate attention by an ophthalmologist. Number 10. NSAID and pain. NSAID relieve pain. Non-steroidal anti-inflammatory drugs, NSAID, such as ibuprofen and naproxen, usually provide some pain relief to people with ankylosing spondylitis. The location, type, and intensity of pain can vary widely in ankylosing spondylitis. Symptoms of ankylosing spondylitis vary from person to person. One person may experience occasional flares of neck pain and fatigue, while another experiences severe chronic back pain, painful eye symptoms, and even spine deformities. Because of today's treatments, most ankylosing spondylitis patients do not progress to the point where posture is visibly affected. However, partial fusion of one or just a few segments of the spine can lead to back pain and restricted movement. Early diagnosis and treatment can reduce pain and limit the loss of joint range of motion. When to seek medical attention? People are advised to see their doctor if they have experienced pain in the low back or buttocks, particularly alternating buttock pain, for 3 months or longer, especially if they are male under the age of 45. Ankylosing spondylitis pain is worse during rest, and when getting out of bed, the pain typically gets better with activity and exercise. Eye pain and redness, significant sensitivity to light or blurred vision, in addition to instead of back pain. People experiencing eye symptoms are encouraged to make an appointment with their primary care doctor or an ophthalmologist as soon as possible. as permanent eye damage can occur without treatment. Please watch and share. Subscribe for more update. Here is my WhatsApp number, Mohammad Nawsad Siddiqui.